Welcome to My Breastie Says, two friends exploring life during and after breast cancer from two totally different perspectives. I'm Chris, a breast cancer survivor and a mother of two.
I'm Jenni, a physical therapist and medical professional who specializes in breast cancer care. Together, we created this podcast to bring both sides of the story, the medical insight and the lived experience. We'll do the record. Okay. All right. Thanks, everyone. We have an amazing episode today with each guest gets better and better. Today, we've got the incredible Jessica St. Clair. She is an actor, a comedian. You might know her from Bridesmaids, from Veep, and the incredible Deep Dive podcast, which definitely check out if you haven't. And then we have Paige Woodward. Paige is honestly one of my best friends in the world, but she's also a kick-ass nurse practitioner. She's Yale trained. She's an expert in oncology. She's worked at incredible places like Dana-Farber, Cedars-Sinai, and she practices functional medicine, which a lot of functional medicine people are like, oh, cancer, oh, no. But Paige is like, bring it. This is what I do. And we are all related to one another. And Paige, if you want to explain how you know all of us.
So I am an East Coast girl, and I made it to the West Coast in 2009 and joined Tower Hematology Oncology Medical Group, which is now part of Cedars. And I was working under Philomena McAndrew, who's still practicing and amazing. And I met Chris.
Paige was my nurse practitioner.
Yeah. What year was that? I don't even know.
Like
2012, 2011.
You know what? I'm not the girl who keeps track.
Yeah, Chris doesn't know.
Numbers, not so much. Like 13, 15 years ago, somewhere around.
Okay.
Yeah.
So I took care of Chris, and then Jenni and I were connected through a mutual patient. She's a breast cancer physical therapist, and we shared a lot of patients. And then unfortunately, I got in a horrible car accident, and she brought me back to life and became my other pea in the pod. And then Jess, are we 10 years now?
10 years.
10 years.
Ooh, and
then I took care of Jess, and we had a lot of good laughs over Ativan and Benadryl. So now I've kept my friendships, and I like to think of everybody as my good friends. Cancer brought us together.
Oh, thank God.
Together.
And Paige recently saved my mother's life.
Oh, stop.
Truly she had stage 4 cancer, and like the day before her chemo, Paige said, oh, I think there's some trials for your mom. Well, the one she's on has saved her life. So that's how powerful Paige is.
Thanks, Jeff.
The power of Paige.
Truth. That's what this that's what this podcast should be called.
The power of Paige. Jess, so nice to meet you.
You too, Chris.
Welcome to the club, unfortunately. And the cancer club. When did you get diagnosed?
September 11th, 2015.
Just put all the trauma on one day, though. That's kind of nice.
It was so stupid. So I got diagnosed, September 11th, and I was 38, and I had a 2-year-old at the time. So it was very terrible time. It's always terrible timing, but
mine was the same.
Yeah.
Same age. Yeah. Well, I was 37, and I had a 2-year-old and a 1-year-old. Well, 2.5-year-old and a 1-year-old.
There is nothing like that. I mean, I always say, and I don't know if this was the way for you, but in some ways it really clarified my mission. I was like, do everything to me. I don't care how much it hurts. I don't care what you have to do, as long as I can stay alive. That was my whole, for my kids, for my child. Yeah. So it does actually, when I help younger women who are, in a different stage of their life, it can be a little bit harder because they're like, well, I'm still dating, and the cut. I didn't really, I didn't care about any of that at that point.
No, me neither. It was so tough going through it with the young kids too. But it gave you a reason, right, to kind of get up. And I remember going through treatment, chemo, and thinking, how do older people get through this? Especially if they don't have the young kids to keep them going.
But in some ways, they can rest.
Yeah.
Yeah.
True.
Yeah.
I think, yeah, I mean, we had to fake it at that age. And I don't know what you did with your kids. My daughter still doesn't know what we went through. And when she's old enough, she will. But
Mhm.
you have to fake it till you make it. Because
Mhm.
at that point,
100%.
if you
Mhm.
disappear to the bathroom alone, they're freaking out. So it's like
Yeah.
you just, it does give you that motor to keep going. You have a purpose for everything you're doing, all the
Mhm.
healthy foods you're eating. When you force yourself to take a walk, it's all for them, you know.
Mm.
Yes,
Yeah.
100%.
And then today, what we're talking on in this topic, we will certainly come back to because it's so big, but how the transition from being like deep into cancer land and then live the best, the rest of your life. I don't think it's as easy as doctors and healthcare people make it out to be.
Mm-mm.
Um, what do you
Mm-mm.
remember, Jess, what that was like? Or again, was it just like, all right, now I'm off to nursery school drop off? Was it?
It was so hard. In some ways, I talk about it being like weirdly harder than chemo
Mm,
because emotionally, I had a really hard time. At first, I was like on cloud nine, and I
mhm.
I wrote a whole season of my show about my journey and my
Jeez.
cancer journey, and so I like relived it. Like
Mhm,
this was during radiation, basically. I was like, in the way we do our shows is we like improvise these scenes, and my real best friend who was with me in the journey was playing herself. It was like a whole thing. And so when I was done with that, I thought, oh, it's wrapped up. I processed my trauma, but it's
Yeah.
mhm,
actually after that everything sort of fell apart for me.
mm,
And I got very convinced that if my life before had somehow given me cancer, that I
mhm,
needed to revamp everything.
mm.
I know. And
That
then
gives
speaking with like Paige being here, you feel when you're in that cocoon and you're finally accepting of, okay, I'm talking about like chemo and the treatments, and you have people like Paige and Jenni taking care of you and checking in on you every day,
mhm,
and you're in the chair and all these things. And then all of a sudden you're not.
mhm.
And you're like, holy shit, wait, where's my nurses? Where's my, am I doing things right? Do I need a test? Do I
Is
need to
it
get my blood
similar?
work done?
Yeah.
I have a question for you too. I never had cancer. I've also never had a baby, but you hear new moms say, like, wait, they're just sending me home with
Yeah.
this child to keep alive. Is it similar? Like, and now I'm supposed to keep myself alive
Yeah.
without,
Well,
yeah.
it's similar, but like there are lots of people who have babies that you can reach out to
Yeah.
and connect to. And there are
Mhm.
very, and obviously, unfortunately, there are more and more young women, but you're very
Hmm.
alone. So, like, I
Mm.
remember feeling very isolated because, like, my other girlfriends were having second babies and talking about kitchen backsplashes. And I was like, oh, I want to burn my house down. I didn't want to be in my house. I like ripped out all the cabinets, I couldn't move. I was desperate to move. I really caused a lot of damage to my marriage because I was angry
Hmm.
and I had to put it somewhere,
Same,
and
same.
it took
Mhm.
a couples therapist actually to say, "Do you think possibly you're dealing with PTSD?" And
Mm.
I don't know why I had to give this woman so much money for her to like 800 sessions later be like, maybe you're not mad at your husband. Maybe you just
Ugh.
are having trauma.
That
And
gives me full body chills. And I think we don't give, I don't know why I want to use the word permission, but why that's not something that comes up, right?
it
That,
doesn't. Unfortunately, like I wish, and I know there was a counselor, but during treatment, but like nobody comes in and is like, hey, if you're experiencing the desire to set your house on fire and like move to Switzerland, maybe
Mhm.
you might be experiencing PTSD. And then here's who to go to for it. Because
Right.
I didn't know there were certain therapists,
Mhm.
types of therapy that you could go to. So I went to a somatic therapist, which is all
Mhm.
about like learning how to calm your body down. But that wasn't enough. And I got to tell you, last November, I found an EMDR therapist,
Oh, yeah.
and that is finally shifted it 10 years later.
Can you explain a little bit what EMDR is? I think of
Yeah,
it as tapping, but I think
it's
it's more than that.
it's crazy. First of all, it's not for the it's hard. It's hard
Hmm.
work. But basically, they're concept is that their idea is it was developed for veterans, people
Okay.
who have experienced or one traumatic event, like a car accident, an attack, that kind of thing.
Mhm.
And so they've used it for that. And basically the whole system is that your brain, your memories can get lodged in one. So normally the brain goes, I think, from right to left. It like takes a memory, then it like processes it, and then it lets it go, or it stores
Mhm.
it somewhere. But when you have a trauma, it freezes it because your brain is
Right.
like, don't ever forget this. Like, you need to be on high alert all the time. You almost died. And so what EMDR does is, with the help of a therapist, you're holding on to buzzers, or
Mhm.
it can be lights, but to me it was better to do buzzers. They buzz back and forth, and first you feel the really traumatic feeling,
Mm.
then they help you shift it to a different way of looking at it. And because
Yep.
these buzzers are going left, right, both sides of your brain are being lit up. So you're not stuck in your lizard brain where you're freaking out.
Mhm.
It's allowing your brain actually to get unstuck and create new neural pathways. And I
Mm.
can say it's been a year. I still have more to go. It works. If you find the right
Mhm.
person, it has to be someone that is all they do. It's a lot
Mhm.
of
Wow.
therapists will say, I do tap. I'm like, do you? I want to know that's all you do every hour is work with people who have PTSD and help them.
And
And
I
that's
can
I'm gonna
imagine though. Oh, go ahead.
I was gonna say I'm gonna need that number from you.
oh, Chris, wait until you experience this woman.
Oh, yeah.
You're in a lot of ways, she is like a mother to me. Like, she's a very calming,
Hmm.
she almost heals the wound,
Mm.
I
by
love that.
saying you're safe now. You
Yeah, it's
can,
okay.
you're
Hmm.
safe. It's okay. And I think that's what we're all looking for.
Yes.
But unfortunately, even our own parents are so panicked. Our spouses are panicked. Nobody
Mhm.
can tell you you're going to be okay. Medical
Mhm.
professionals can't say you're going to be okay because they don't know.
Right.
Yeah.
Right.
So
Yeah.
you just, yeah. So anyway, did it take me 10 years? Yes. Am I hoping that someone will hear this and not wait 10 years? That'd be great.
Yeah. Yeah. And I also want to acknowledge though, but for a lot of us, no matter what your emotional baggage is, it is very scary to be like, shit, now I have to sit in a room for an hour and talk about it and feel it. I've worked really hard to like put that back in the closet. But
It's very hard, but also know that you never leave there, if the therapist is doing it right, without feeling better.
it's a
They
great
don't
point.
let you go until they've guided you to a safe space. And then
Mhm.
you'll notice days afterwards you're very tired because your brain is busy basically reshuffling
Processing.
everything,
Hmm.
like a
Mhm.
librarian going, wait, that book is here, that book is there. So you're very tired, and then after, it's almost like chemo, after a couple days you're back again,
Mhm.
and you do see things differently.
Mhm. That's
Love
So
great.
that.
yeah,
Yeah.
yeah.
I've heard
So
so much
yeah.
about it, and I don't have you guys tried it? Jenny, you haven't, but
I've
Paige, have
done
you?
somatic therapy, which
Yeah.
has
Hmm.
been helping me. I did EMDR with someone who doesn't specialize in it. I'm like, this is stupid. And that was years ago. And that was the end of it for me.
That's
Yeah.
exactly right. I tried it a little with the somatic therapist, and I was like, what the hell is, I'm not tapping.
Hmm.
And I can't tap my leg. No, they should have buzzers. If they don't have
Hmm.
buzzers, they're not in
They're
business.
out.
You know what I mean?
You
Yeah, they're
either
out.
have you either have the tools or we're walking out. We're walking.
100%. But what was interesting is they thought that it was just effective for big T trauma, which is
Hmm.
like that car accident or that whatever. And but then they realized actually it helps with complex trauma, which I think people who
Hmm.
have breast cancer, and again, do I have a degree in psychology? No, I think we have both, because
Hmm.
yes, we almost died, but
Hmm.
also what followed that could also be traumatic.
My God, 1,000%, right?
Yeah,
Like you lose your breast, you might lose your hair.
all of
All
it.
of it.
All of
Eyebrows,
it.
eyelashes, you're
Yeah.
feeling like shit. Yeah. Um,
Hmm.
and then I mean, Paige, you can talk to like mix that in with a bunch of steroids that people put, don't
Oh
you? I mean,
gosh.
I feel right? Like that's like talk about burn the house down.
Truth.
No,
Yeah.
we dump all these toxic chemicals into you because we want to save you. We do all this stuff to you. And
Hmm.
then you finish and we're like, yay, the cancer's gone. See you in 3 months. And
Yeah.
Hmm.
it's like it's very traumatic. I mean, I worry about people. Like people would go away and, people are like, oh, I don't want to call you. I don't want to bother you. They're like, oh, I'm finally away from the cancer center. But I feel like we need to do a better job of holding on to people. And, cancer survivorship is growing. Some of the big, hospitals, NCI designated cancer centers have them, but it's so important. We kill you guys with all these drugs and we need
Paige,
to bring you back to life.
Well, I
could you,
remember when Paige said to me the first day we met, and she was such a breath of fresh air. I was so scared. Then Paige comes in. She's like, "Oh my God, you got this." She's like, "If you are feeling symptoms, I'm not giving you enough drugs. Like, you got to let me know, right?" And it's like that. It's like you kind of want someone to go, "Here's what to look out for." And if you are feeling that, you got to tell somebody.
Yeah.
Right.
Mhm.
Like,
Mhm.
I think a lot of, I mean, I like to say that breast cancer really hits the most attractive women the hardest.
I agree. Oh my
Okay.
God.
It's obvious.
I was gonna say that. So
Everyone in the chairs near me were very good looking and very high functioning. But I think that if you are high functioning, you mask that you're
Yeah.
having a hard time.
Mm-hmm.
And you just want to be normal again, but like your vagina's falling apart and you're like, what's that about? Everyone else is not going through menopause at 37.
I
Yes. And
know.
Jess, to your point, I did kind of want to talk with Paige about what are some of the things that the healthcare system can help you with, should be helping you with, but is not. Because I do think I find talking to patients too, there are things that are like, I just thought it was a me thing, or I didn't know you could help me with my vagina on the floor, or whatever.
Like I think it's almost like women have always shared secrets with each other,
Mhm.
but I don't want it to be a secret.
No, it
No.
shouldn't be. It shouldn't be.
Yeah. Paige, what are some areas you found that your patients need support after?
I think, well, now because all this menopause and HRT stuff is talked about, and I know, if you're a hormone positive breast cancer, you can't have the estrogen, but vaginal estrogen is safe for almost everybody.
Yes,
Preach,
And
louder for those in the
preach,
back.
It is? Oh my
preach.
no one
God.
should
Because I was
suffer.
Chris, you got to shove
And
those.
okay.
They're
Oh,
tiny little pill. Like you get it in like what looks like a
yes, that's
miniature
Vagifem.
tampon. It's like a
uh-huh.
tiny little thing. You put it up there. It's a tiny pill. There's no mess. There's none of this
Oh
fucking
my-
creams or bullshit. When I tell you,
It's life-changing?
oh no, it
Yes.
brings back your 16-year-old vagina. Suddenly it's
Oh,
Wait,
alive again.
what? I am
No.
so happy about this podcast for this reason alone.
That and Paige, then I want you to talk again because you actually have the degree. But there's another thing. So like the entrance to your vagina, like the cervix, what is that's
The
not your cervix,
vulva,
the like ring, right? Right
Mhm.
at the top. That
oh, the
gets
clitoris,
Yes.
no, it's
No,
like
you mean like
the
the
vulva.
opening. Yeah,
entry.
the actual opening.
I,
Yeah.
I'm
Okay.
Entry.
I'm from Jersey. I was gonna be like the clit.
Yeah.
I'm from Jersey too, Chris, which is why like I don't understand anything that's going on up there. But like whatever the entrance of can be the
Yeah.
thing that hurts, right? When you
Uh-huh.
try to have sex. And there's a gel that's like a little bit of testosterone, like 0.01 testosterone, and maybe it's a little estrogen as well. It doesn't get into your bloodstream, but you put that around the entrance of it, and that brings that tissue back to life.
Mhm.
Mm-hmm.
What
I also
does
need
it lift our faces too and do
Honestly, you're not
Yes,
so
estrogen is
angry
your
all the
friend.
time. Estrogen is your friend.
I
Yeah.
know, but
Well,
so wait, let me ask Paige. I have a question. Who do we go to get this? Is it the OB? Is it
a great
our
question.
oncologist? Because I have gone to Philomena was my doctor, and I went to her about hormone replacement. She's like, no, 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 your cancer was really aggressive. I don't think you should. So who do we go to for something like this?
so your oncologist certainly can give it to you. And I
She'll
know that
give you the pill.
she is pro vaginal estrogen.
Okay.
I prescribe the pill a lot because it's less messy, but some people prefer the cream. Whatever your thing is, get it. And the reason your vagina feels like it's gonna, it's falling apart and broken is because estrogen keeps everything, well
Tight.
moisturized and
Tight.
happy.
Yep.
And and then we take that, all away from you because we do all the estrogen blocking. We probably put you in menopause early. So your oncologist, you know, a lot of people are still skittish and scared, but there are so many articles, like research articles that are published and have been published continually stating their safety. And I think it's the American Urological Society put out a new guideline saying that
Mm-hmm.
basically vaginal estrogen is safe for almost everybody. It's in the Menopause Society guidelines. You can go to your OB-GYN, your primary care, but again, people are still skittish. I have seen so many breast cancer patients who are on, you know, estrogen blocking therapy, like the aromatase inhibitors, tamoxifen, and they're like, I'm miserable. And I'm like, you can have vaginal estrogen. They're like, what? And
Mm.
they're scared. They're like, no, people said it's not safe. I'm like, okay. And then we sit and
No.
go through all the articles.
If Philomena
So,
says it's safe, it's safe.
yes.
It's safe.
And she's
Yeah.
been doing it for years.
I even made her like a psycho. I made her test blood to make sure it wasn't getting in there, and there wasn't any.
Oh,
It's
wow.
such
Okay.
a small amount because it's so locally absorbed. It's not
Yeah.
like systemic, you know, if you took estrogen replacement, you know, it's
Take a pill, it goes
going
through your
everywhere. Right.
blood every
Yeah.
Right.
And then
Um,
could I speak to your face falling apart? Because this is not obviously like
dries out
keeping us
big time.
alive, but
Oh,
I'm an actress. I
Mhm.
cannot age faster than normal or I won't make money. And I noticed my face was like falling down. Like it was almost like I was like that droopy dog. Like I was like,
me
Mhm.
what the
too.
fuck
Yeah.
is going on?
Hmm.
So I was summoned to Houston by one of my best friend, Dr. Jenni Siegel at Metropolitan Dermatology. And she said, come down and I'm going to build your face back up.
Oh, tell us about that. I'm intrigued.
I know this is not keeping us alive, but it also is keeping us
No,
alive.
it
Yeah.
is
Same.
keeping us
Okay.
alive. I'm taking notes right now, by the way.
Okay.
Vag pill is at the top.
Yeah,
It's called
vag pill.
Vagifem.
Okay, so I go down to Houston, okay, and so she's like, okay, well, basically, now she studied under a woman, Dr. Fitzgerald, Rebecca Fitzgerald, who basically was the person who, when AIDS patients were
Mhm.
losing all of their structure of their faces, figured out how to rebuild their faces with Sculptra, whatever that was
Hmm.
at the time, and lasers. So basically, Jenni, Dr. Siegel, built up my face with Sculptra, like basically rebuilds the
Is that kind of
structure of your
a
face.
type of
It's a
filler?
filler that
Okay.
becomes, I believe, becomes collagen. So basically, the reason your face is falling is because estrogen creates collagen, which I did not know.
Hmm.
Well, just like your vag, you can fake it down there. You can also mimic
Mhm.
collagen. You can jumpstart collagen production by wounding underneath your skin.
Mhm.
And then your skin has to go, and then your body goes to repair that and creates collagen. So,
Mhm.
yeah, it's a fucking bummer that we have to do this. And it hurts like a motherfucker and it costs money. So I know it's
Mhm.
cost prohibitive, but sometimes dermatologists will give you a break because they know why
Mhm.
you're in there. I only
Mhm.
do it once every 2 years. But when I go down there, they give me a Vicodin and they do something called all therapy, which is like deep ultrasonic heat, which basically wounds you underneath and then it repairs. They do a hot micro needling, which does the
Oof.
same thing. They
Mhm.
do this all in one day, by the way. And then
God.
she builds up the structure of my face.
Oh, I
Mhm.
And
love that.
and I have seen the pictures of 10 years ago till now, and I do look better than 10 years ago because
Mhm.
but it's maintenance and it's a bummer. And I
It's a
do have to
full-time job,
it's a
is what it
full-time
is.
it is,
Yeah.
but I will tell you when my face was rebuilt that first time, I bawled on my plane home
Oh,
because she gave me back my
No, that's
feeling
incredible.
pretty again, you know. And
yeah.
even if you can't afford the sculpture and all that, just look around at what might be affordable in terms of the lasers and shit that hurt because
Mhm.
if it's not hurting, it's not working. So,
Mhm.
I know. I did the soft wave with Jason
yeah,
Diamond a
worth
few
it.
times, and yes, that hurts. I know we're getting off topic, Jenny,
But
because
are
there's
we?
always a
Yeah,
No,
beauty
no, I think she's
topic.
right.
I
I think
mean,
this is
we're
topic.
women,
Yeah,
right?
this is topic.
Yeah.
Mhm.
I'm always like the face peels and all the
But no,
things.
it's
Yeah.
really like if you're thinking about estrogen, right, Paige, you want to wound yourself underneath, which sounds crazy, but that's what'll mimic it.
Yeah, and
and
just to
well,
that point, sorry, I was
go ahead.
gonna say they've been doing that in the orthopedic world for years
Have
because
they?
our meniscus, if you think of them like knee meniscus, if you ever heard that term,
Yeah.
when they get worn down, they'll go in and do these little micro tears under
I
surgery to
didn't know
help promote
that.
that. So yeah, same college in there. That's why We had a whole episode about exercise in menopause because the estrogen affects your tendons and cartilage. It's another reason why your body can feel lousy.
I'm learning a lot.
I'm sorry,
Yes.
Paige. What
As
were you
I'm
going to
I
say?
was
spraying
going to
my
say
face with
estrogen, just
Evian.
the
Yeah.
lack of estrogen, you're so dry too.
So dry.
Your skin is like horrifically dry. And I'm seeing this not from, having had cancer and gone through what you ladies have gone through, but, now being in my mid 40s and this perimenopause
Yeah,
BS, I'm
Oh,
like, this sucks.
it does suck.
Um,
It really does
and
suck.
yeah, and I'm kind of like, okay, what are we going to do? And I found a skincare line called One Skin, no affiliation with them, but
Writing that
it's
down.
peptides. It's made with peptides, and that's like all the rage and something I've been studying because I think there's going to be a place for that too, possibly in helping with some of the side effects and symptoms people have long term from cancer
Done.
treatment.
this
If you
is
recommend it, Paige, then it's
Yeah,
done. It's
done.
already in my cart.
I use that. I
Oh,
actually
you
use
do?
that.
Do you?
The décolleté and neck cream, it's like their hero product.
Mm.
I'm a beauty product
Well,
whore.
obviously,
And
look at your skin. You haven't
no,
been doing any of this shit and you look so good.
I'm tons I get like these monthly peels. But it's
Bless.
funny, Paige, you said about the peptides. My son is like, he's 17 and he's super into like working out and
Mhm.
lifting and bulking up and then cutting down. Like, he's like an encyclopedia of like knowledge. And he's like, just trust me, mom. He's like, the medical is going to be giving peptides for certain, like they're going to be
Wow.
prescribing this soon. He just said this to me last night because he's like, you should get on this for hormones and but
Right.
not just for mood
Yeah.
because I want to kill everybody in my house
Yeah.
right now because I am
Relatable.
menopausal and I
Yeah.
thought I was over it and it's
Yes.
back.
That's another thing I'm going to say. Menopause, I
Mhm.
didn't understand what it was doing to me mentally.
Yeah.
Mhm.
So I
Mhm.
knew that the hot flashes were horrible. And I also, Philomena prescribed 150 milligrams of this very old SSRI called Effexor.
Mhm.
That cut my hot flashes. I get a quarter. I used to get a quarter of the one. I would get like 3 an hour, and I went to getting like one a day. So Effexor is something, again, nobody shares with anybody. And so they think I just have to have hot flashes
Oh my
forever.
God.
Um, but also I think mentally I became really irritable,
Mhm.
down. I felt very erratic, like my mood swings were crazy. And my husband kept saying, I think this might be menopause. Now, if you remember what it's like when a husband says, are you on your period? And I'm like, oh, you want to see me burn this motherfucking house down?
Right.
Say I'm
Those
crazy
are
because I'm
fighting
on my
words.
period. Say I'm fucking crazy. So I was like, nope. I'll tell you what it isn't, menopause. It's you guys. I hate you.
I hate you. Oh, I'm leaving.
Yep.
Yeah, like maybe if you guys weren't assholes, then I wouldn't have to yell at everybody, but I
Exactly.
do think if you're thrown into menopause overnight, you also need to understand you might be losing your mind for that
Mhm.
reason.
The
No one
lack of
prepares you for
focus
that.
and the
Mm-mm.
lack of focus, like it's
Uh-huh.
so hard. I'll start doing one thing. This is not who I used to be. And then I'm like trying to do five things at once and I totally forget. And then I just
Mhm.
want to give up on everything.
I
hundred
also
percent.
lose words constantly. Does that happen to anyone else where you're
Oh,
like,
yeah.
so can you do the and just get
Yes, the
looping,
brain
like
fog
glitching?
is
Yes.
real. I think that's why
Yep.
it's like very hard to know. A lot of women get diagnosed with ADHD in their 40s. And
Mhm.
I was like, maybe I have that. And who knows?
Yeah.
Maybe I do, but it was definitely menopause related too. Cause I can feel myself now, 10 years later, I'm really past it. And
Mhm.
to be honest, I'm not very nice. Like my other girlfriends are going through it now. And I'm like,
Uh-huh.
I'm done. I was like, oh, you're hot and now you're cold. Like I'm wearing sweat. I thought to myself, I'll never wear a sweater again.
Mhm.
That sweaters are done for me,
Yeah.
Right. Yeah.
but I'm back to some sweaters sometimes.
Wait, let me ask the Vagifem
Yeah.
page. Is that
Mhm.
what it's? Yeah.
Or
Yes.
estradiol is, yeah, whatever that.
Does that help besides building back the physical vagina? Does it help with the things you're saying, Jess, like the mood swings and stuff? I
No,
hope.
no,
No.
it doesn't
No.
get in your bloodstream. It's just down there. The mood swings, you're
Yeah.
kind of fucked. I would say though, like probably SSRIs, that kind of stuff. I'm on a mood stabilizer called Lamictal that
Mhm.
Mhm.
helps me. Like I don't go up to a 10. I'm at a 6 to a 3, and that's really been helpful. I think finding a psychiatrist who's probably a woman who's dealt with this could be really helpful. Like, I just feel like hit it on all sides because you deserve it.
You need
you've been through
a
it.
lot of support going through all this.
Yes.
Oh,
It's
a
because your
lot.
hormones have gone completely out of whack with cancer and us blocking everything. And, for people who haven't had cancer that can have HRT, they get progesterone, which is like your mood calming hormone, and they can get testosterone and they can get all this stuff. And, I think it's really, it sucks for estrogen positive breast cancer survivors who have had a very aggressive cancer that can't benefit from that because it's just,
sucks.
But they're coming out with more and more medication that's like not SSRIs that help with hot flashes. Veoza is one of them that got approved. There's a new one and I forget the name of it right now, but they're
That's
working on
great.
stuff.
I didn't know that. That is awesome.
That is awesome.
And they've done trials with them, and they're looking at different things. And my biggest thing for anybody is exercise, nutrition. But yes, mental health is such a huge piece too.
Can you talk a little bit about nutrition? Because I think I've heard lots of women say, again, like, I don't want this cancer to come back. What can I do? And can become really overwhelmed, scared, obsessive. What's your like quick takes?
So, people are like, oh, I should never eat meat again. I should be a vegan. I should do. And I think it's eating, as many whole foods as possible, a balanced diet. I'm a big fan of protein and like quality protein, not like processed from like a protein bar. And if you want to have a steak or a burger, go for it. So I'm a big fan of just getting all your protein, your veggies. You can eat your carbs. I mean, everybody's seen all this stuff about alcohol. There's a lot of data now showing that, any little bit of alcohol can really increase your risk of cancer, 9 different types, but especially breast cancer. But, is it going to kill you to have a glass of wine here or there or a cocktail? No, you have to live.
Could I suggest something else that I've gotten involved in?
Sure.
A CANN beverage is the delicious thing you will ever drink.
What is that?
It has 2 milligrams of THC.
Ooh, nice.
It is the chill out of a glass of wine with 0 hangover. It's sweetened with agave syrup. It tastes like a goddamn soda. And it is like the best thing you've ever drunk. And it made me feel so much better because I was like, every time I had a glass of wine, even if it was once every 2 weeks, it's not fun to drink it and go, is it killing me?
Yeah,
it's not, but I couldn't enjoy myself. So I was like, I got to tell you, you were the first person to give me a marijuana prescription back in the day, Paige.
I mean,
we had to write them with the gold plate on them.
Yes.
Yes.
I was like, I say to people who are going through cancer, I'm like, don't be conscious of this. Do you want to remember this? No.
Right.
Be high as much as you possibly can. When you're not with your children, you're high. If you're not working, you're high. Don't be aware of this.
Well, I love that you mentioned that. You're a wealth of knowledge, by the way, for me. I can't imagine our listeners, but when I was going through chemo, you're so fucking sick and tired and all the things that, like, I remember, Paige, you giving me a prescription and I was like, I went down to like Buds and Roses to fill it up and I was like, what kind? And I just felt, first of all, I didn't want to smoke anything because you're
right.
Just because you're like, oh, to get up and like go outside and smoke a freaking joint. And then the edibles, I was just like, am I going to get nauseous? I don't know. This canned beverage, I'm going to try that too.
It is, guys.
I'm going to put it on my vagina as well.
Why not?
No?
Honestly, though, like, I also feel like in these days, in these hard days of life, I don't care what you've been through, it's hard to relax and like be in the mood to like do anything fun. And so it's like, to then say, oh, and guess what? You can't have any mind altering substances ever. I'm like, fuck you. I don't take it all away. I'm really of the mindset, like, we can find a fix for almost everything. We just have to search for it. We have to have people like Paige who are like giving us the information. I always send patients who come to me to Paige, and I say, there's so many supplements we can take while we're going through. Afterwards, I'm going to book after this, book a session with you, Paige, because I feel like I know I'm depleted on some vitamins and stuff. But like, I just feel like I don't want women to feel like this is the end of being pretty, having sex, and having fun.
Yes.
I
And I
agree.
think the same goes with food. I went to some scary, I know Paige got the my rage end of this, but I went to some scary dietitians who were like, you're going to eat lentils for the rest of your life or you're going to die. And I'm like, fuck you. Like,
Yeah.
I'm not doing that. And I can't, it's not sustainable. I tried it,
Yeah,
but
I did
like,
too.
it doesn't, yeah, it
Lentils are
doesn't.
death.
Black lentils. Yep.
My mother remembers me like in the middle of chemo, like sitting down to like a bowl of lentils. And it's like,
Ugh.
and I can't, for my body, I can't function without meat. Like, I don't eat
Mhm.
red meat anymore and I don't miss it, but I can't, I just like am too tired when I tried to be
Mhm.
vegetarian. So like, yeah, Mediterranean diet. My husband also was diagnosed with stage 4 cancer the day of my last chemo, and
Oh,
he survived. And I say to all those stage 4 people out there, like, it happens, you can survive. But after his treatment, like a total psycho, I went to somehow got into like the heads of oncology at all these hospitals. And I said, what can we do to keep him alive? And
Mhm.
they said the two things are a cardio exercise, at least 20 minutes a day, and a Mediterranean diet. Okay,
Hmm.
we can do that. And
oh
I said,
Yeah.
wow.
why don't you tell everybody this? And they said, well, honestly, Americans especially won't do it.
Yeah. It's weird.
And
They don't want to hear
just,
it. But it cuts the
yes,
risk, right, Paige? And in
it does. It does. And I think and then people get super scared because he had colon cancer. I also took care of him as well. Um, it's the processed red meat, like the bacon, the prosciutto, that kind of
lunch
stuff
meats.
yes, that have like the nitrates, whatever. That's the stuff that you really need to stay away from. If you're getting like a good quality, and you shouldn't eat it like every night, but if you get a good quality, like grass-fed steak or, burger or something, it's okay.
It's okay.
People are so scared, but generally, yes, a Mediterranean diet, the good fats like avocado, olive oil,
Mhm.
you're eating your vegetables, you're eating fish, lean proteins. And I know not everybody can get the best quality of food because, you know,
It's
stuff is
So
very
so
expensive.
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 Yeah. So
People
expensive.
have lost jobs, but you do
Yeah.
the best you can. It's just really unfortunate people who do need help with food get like Cheetos and soda. Like, great.
Right.
Like, this is the stuff that, you know,
I do love that you just said that we just do our best because I think that's also really important. Like, it's really easy as a woman, particularly, to be like, I'm going to do the goddamn best at
Yeah.
this. Like, I'm going to do all of the things all of the time. And I think it's nice to like share that grit. Like, Chris and I talk a lot about grit and grace and the idea that, like, cut yourself some slack. Like,
Yeah.
things are expensive. We don't have all the time in the world. Do your best. And that's all you
mhm.
can ask
Yeah,
for.
there are going to be weeks where yeah, it's too busy. Like last week, I couldn't work out. Okay.
Mhm.
But like, I'll get back to it.
Yeah.
And I also think the one other thing I was going to say is like my knees, my joints started to like
Mhm.
Mhm.
really feel it. And so they do give me the collagen injection, or is it
Mhm.
collagen? What is it that they put in there? It's like a
PRP, is it
gel.
that one?
No, it's a
Oh, no, it
gel.
is.
Yeah. And I sometimes you have to fight with your insurance to get
Mhm.
them to
Oh,
approve it.
yeah.
Right. But I basically said to them, he said, listen, if we do nothing, you're going to have to get a knee replacement at like 60, or we can
Mhm.
do this. I am almost like, let's do it proactively
Mhm.
because you can't make collagen out of nothing. You can't, right, help tissue out of nothing, really. So like, let's wait, just get ahead of it.
Mm.
And
That's excellent. Yeah.
yeah, so that's something. If you're feeling like your knees are cracking more or any of that, like it's probably because the estrogen's affecting the
Totally.
tissue.
So physical
Yep.
therapy can be really helpful in that
Yes.
too. Different, I have a friend who also a cancer survivor. She found when she was doing all of the things like not drinking alcohol, for her gluten really bothered her, but doing other things to lower the overall inflammation in her body, her knees would feel better. Like she'd have less joint
Yes.
pain. So
Oh.
there is sort of,
Mhm.
right, Paige, you could speak to that too.
Yeah. Well, I was going to say one of the new things, and they're looking at it in studies. Everybody knows about the GLP-1,
Hmm.
Ozempic, Wegovy, tirzepatide. There's phenomenal data coming out, not just for weight loss. Like, and I know there's not like studies and saying like, a lot of people are microdosing them, meaning
Okay.
what that means is they're taking a half the dose of like the starting dose. So tirzepatide is like 2.5 milligrams. They're taking like 1 milligram a week or something, but they've seen such a reduction in like inflammation, cognitive like It's helped with like cognitive abilities. They're
Wild.
seeing lower risk of dementia. And I feel like there's going to be a place for these,
Mhm.
Yeah.
I'm
It's
you
so
know,
exciting.
glad you said that, Paige, because the one thing that was really hard about menopause and I forgot is that like I put on 20 pounds. I
Oh,
Mhm.
went from
yeah,
like never
same.
having to worry to
Hmm.
like always having to worry. And I had every year the doctor would say, you got to lose weight, you got to lose weight because every pound of fat is more estrogen. And I'm like, oh my
Mhm.
God, I can't. And I
Mhm.
tried everything and I was starving all the time. So finally, you're 2 years ago, a year and a half ago, I said, Philomena said, have you ever tried the GLPs? Like, why don't you just try that, microdose it?
Mhm.
It took 10 pounds off, which was
Mhm.
enough. And I cannot tell you the mental load took off me because it
Yeah.
feels like you're failing somehow. And I'm like,
Mhm.
oh, okay. Why? And of course, when Ozempic first came out and everybody was upset and rightly so that it was there wasn't enough and diabetics were not getting but like we're at a point now where hopefully you can try to get it in some affordable way. My neighbor just
Mhm.
got it. I don't know what place, but she got it for half off. But it feels like such a load off me because I don't
Mhm.
feel bad. I'm not afraid of my weight. And also, I feel
Mhm.
better. I can work out easier.
Mhm.
My
And
joints have less weight on them, you know?
Mhm.
the more lean we are, the less chance of reoccurrence too.
Correct.
So for that, and like I can speak to myself and my friends with 51 years old over here, and you're working harder and you still have that 10 pounds on you. And it doesn't matter how hard you're in the gym, doing the
Doesn't
classes, doing
matter.
the weights, you still got that 10 pounds. So
Mhm.
yeah, I'm a fan as well.
Yeah. Is
Mhm.
You
it
can
the easy way? That's so crazy. I'm so tired of women like doing it the
no.
hard way and
Yeah.
I
like
Yeah.
mean,
blaming themselves,
Yeah.
right? Like, oh God, if I didn't have this. No, you didn't do it to yourself. Men don't go into menopause like this. It
Right.
doesn't
men,
happen to
I
them.
mean, we give birth. Isn't that hard enough? Can't we take the easy path
Thank you.
once in a fucking
Yeah.
while? Jesus.
Thank you.
Okay.
But it isn't necessarily just the easy path because you still have to work out and maintain your muscle because those drugs can cause you to lose quite a bit of muscle, and
Yes.
muscle is your friend. It's going to
Mhm.
support your bones, going to help your joints, keep your metabolism. But no, I think we're going to see more of that, and I know that they're working on trying to like lower the prices because they're making guidelines very hard to get them with insurance. Like you have to
Yeah.
be very obese, you have to like have documentation that you've done all these things. But
You
they're starting
should.
to lower the prices and make these more available, and there are some compounding pharmacies that will make them as well, but you have to find a really good, legit quality place to do
Right.
that. You'll see a lot on the internet.
Mhm.
People are selling, you can buy vials and mix them yourself. And I'm like, no, 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 you
Let's not
shouldn't be
do
doing
that.
chemistry at
Yeah.
home. Yeah,
But
yeah.
something to ask is sometimes your physician will have samples and you're like,
Mhm.
can
Mm,
I get some samples? Like the first year I was on it, I just would show
What?
up and yeah, he would say like people are dropping off like boatloads of this stuff
yeah.
to doctors to recommend. He go, yeah, I have more than I need. Take it. But
Okay.
And
if you don't ask, you don't get
Right.
from
You
New
wouldn't know.
Jersey. You
Yeah.
wouldn't know. I mean, maybe. Or like I also did a treatment on my vagina. Now I don't know how much it helped. I haven't done it in a long time, basically because I forgot, but something called the Mona Lisa, which
Yeah.
is
Oh,
like
I heard about
laser.
that. Yeah.
But my OBGYN was so lovely. She was like, I'm just going to charge you what it costs to turn the machine on. Like, don't be
That's
afraid
great.
to ask for a discount.
Mm-hmm.
We've
Use
been
that
through too
cancer.
much. Use that big C card. Like,
Yep.
Mhm.
Yep.
what's the
That is
worst
the
that could
Jersey
happen?
way. That's the
It
Jersey
is.
way right there. Yeah. My
Yeah.
husband's from LA, and
No, it
he,
horrifies them.
he could like that. And I'm like, but now he's kind of meeting me in the middle.
What's
I'm
the
like,
worst thing they can say? No.
yeah,
Right.
big
Okay.
deal. Big deal.
And
Yeah.
one last thing, I know Ozempic comes in a pre-filled pen, and but you can adjust the pen. So if you're doing a microdose, like you could buy that, with cash, but it might last you instead of like I think it's got 4 doses in it, which is like your normal weekly injection. You can make it last for 8 weeks.
That's what I
Mm-hmm.
Um,
do. Yes.
yeah, yeah.
Mm-hmm.
So
And it was
there's
enough. It
ways.
was enough to shift. If you
Yes.
really want to drop like 50 pounds, yeah, you got to crank it up, but see what the lowest dose will give you.
Well, some people are abusing it. We've all seen the
Yeah,
people
yeah.
with the Skeletor faces and the thing. And those are probably, to your point, Paige, the people who aren't working out and eating, the protein shakes and the protein meals and all the things. I'm really bad with that, with eating enough protein, but I'm
Hard. We'll
trying.
have to do
I'm
a whole episode
trying.
on how to get protein because it
Yeah,
is
Yeah.
hard.
that is
Not
Yeah.
enough
hard.
meals in the
Or
day.
lifting weights, that's a hard one for me.
That is
No, I'm
hard
a
too.
class girl. I'm more of a
Me
class
too.
girl.
I also changed the way I worked out. Like, I mean, I hate running, but I used to do it, but it wasn't good for my knees anymore. So I found a bar method class that's like me and sometimes a lot of 80-year-old women, but God damn it, are these women flexible?
Those are hard, those
They
classes.
were hard. These women are
Yeah.
doing it, but that's
Yeah.
something like you
That's good.
finding an exercise routine that's sustainable
Mm-hmm.
and that
Yes.
isn't going to damage you,
Mm-hmm.
because right after cancer, I decided to go with my 23-year-old nanny to some boot camp and I
Oh
fucked
God.
up my
Oh.
everything. I was like, what the? You don't also want to do anything that makes you feel worse about yourself.
And then you hurt yourself, and now there go the next 4 months of
That's
exercise.
right.
So, yeah.
Then you're depressed. I
Start with
felt like
walking. That's what you
I
need to start with.
I
Walking,
think
exactly. I love walking.
after treatment and after getting through cancer, I felt like when I was being taken care of by the womb of Cedars and Paige, I felt like everything that I was going to put in my mouth would be killing me.
Yes.
Like, you know what I mean? That whole like neurotic, like that's,
If you
to
have
your
any
point.
sugar,
Oh
that's
yeah.
bad. I couldn't cut out. I mean, chocolate is in my life again. I'm
Same.
sorry. My husband cut it all out. Like, and I hate him for that.
Yeah,
I
that's
wish I had that kind of willpower, but I don't. That's not gonna, I don't believe, I think you have to get out of the mindset that you gave yourself cancer.
You
I
didn't.
know. Well, it didn't run
say
in
that
my
again,
family.
Paige.
Did it run in your family? No.
Sort of in my father's sister, but like still I think that the natural urge is to say I want to control this, and how
Yeah.
can I control this but to say I gave this to myself. And I used to tell stories, and I still do sometimes, about, oh well, I was working so hard, I was working 14-hour days and that's why I got it. Probably not, right,
Mhm.
Paige?
No, you didn't. You have a genetic mutation too.
Oh yeah, I forgot about that, but I do
That,
still
I
believe
mean,
I gave it to myself.
but that puts you at higher risk. And not that this podcast is about me, but like I have a family history, and if we can on another episode talk about the Tyre Kruzik model where you can calculate out your breast cancer risk. And I'm over 20%, so I'm a high risk screener, and I get mammograms and MRIs constantly, and I've had
Right.
biopsies, and like you just
Is that what Olivia Munn did? Yeah, she took
yes,
the test, right?
yes.
She's a friend, and she's never been happier to have gotten that taken care of,
Yeah.
you know?
Paige, let me ask you this, because this is a question I have been thinking about. Why are women still getting MRIs when I mean, no, mammograms, when an ultrasound like
It's so much
is
better.
so much better for us? It shows more from what, I mean, I don't know, you can answer that, but like, why do we have to do that middle step
So
anymore?
actually, mammograms. So I have extremely dense tissue. They can never find anything, and then I get an MRI, and they're like, "Oh, spot. Oh, spot. We
Yeah.
need a biopsy." And but it can pick up calcifications, and that MRIs do not really pick. Like it's very hard to see
Uh,
calcifications.
mhm.
I mean, there's a lot of stuff on the internet which drives me insane, having worked in cancer for 20 years. And they're like, "Don't do a mammogram. It's going to kill you. You should do some. I
Yeah.
don't know, please go get your mammogram. They actually do save lives. There's been a lot of people, it's been found. Um, but if you do have really dense tissue or you have a genetic mutation or you're for high risk, you're probably going to need an MRI. I mean, I went through a biopsy a year ago. They couldn't even see it on an ultrasound. I had to do it under MRI guidance
Right.
because it was so deep and it was so far back.
Jeez.
And so, like nothing
Mhm.
is perfect, but go get
But
your
you gotta go
checkups.
through the motions, yeah. I
Yeah.
mean, I had a double mastectomy, so I don't get the mammograms, but I've just been
Right.
hearing a lot of chatter. You're right, on the internet, and everybody wants to
Yeah.
take a stand, and I just feel
Mhm.
like there's balance. There's got to be balance to everything, right?
And the amount of radiation, I think a lot of people are freaked out about that. It's very little. Like you get, I think they said you get more radiation in a plane flight than you do
Yes.
from
Ah, okay.
a mammogram. Um, but there's a lot of people that they find their cancer on a mammogram.
Mm-hmm.
And Olivia is very lucky that her gynecologist did that risk model with her because
Well, I just want to say too, like I feel terrible bringing up a lot of these things that like just aren't available. Like we live in
Mm-hmm.
Los Angeles, there are a lot of
Mm-hmm.
things available to us
Mhm,
that aren't available
Yeah.
anywhere else in the world. And people have different financial means.
mhm.
So, but I will say the one thing is that sometimes you have to ask 10 times before they do it.
Yeah.
Yep.
So, and it's like I just heard of a friend who, you know, unfortunately, a friend of a friend who unfortunately they were like, she found a lump and they're like, we can't see you for 6 months.
Ugh.
That's not okay,
Mm-mm.
but okay, if that place won't do it, go somewhere else. If
Mm-hmm.
you don't get a
Mhm.
good vibe
Squeaky
from this
wheel.
oncologist, go somewhere else. If a plastic surgeon says, well, that's all we can do, and you don't think that's what you want to do, go somewhere. There's a million people who do this. Um, but sometimes you just have to keep asking.
It's the squeaky wheel, right?
Mhm.
Absolutely.
Yep.
It's the one place, medicine is the one place where the squeaky wheel will get you the grease, right?
Mhm.
Yeah. Yeah.
Yeah. Well, I think we could probably keep talking for days. So maybe
Yes,
we can do this again sometime.
absolutely.
Ugh, I would
Thank
love this.
It
you
was fun.
so
And
much.
Jess, can you tell people where they can find you?
Sure. The Deep Dive podcast I host with my one of my best friends, June Diane Raphael. You can get that anywhere you get your podcast. And I will also say my husband wrote a book called The Survivor's Notebook. It's a book of
Mm.
poetry about his couple years after. You can get that anywhere, Amazon, anywhere, but it might be a nice poetry
That's
can
lovely.
sometimes speak to you in a different way that hits you,
Mhm.
can
Yeah.
so if
I have a
anyone's interested
copy.
in that. Yes, Paige
Mhm.
has a copy.
He sent me a
Exactly.
signed copy.
There you
Oh,
go. You
So
save someone's life. They give you a signed copy of their book. Is that
that's
worth
on
it?
Amazon. That's on
Yeah, it's called
Amazon. I'm gonna order
Dan
it too.
O'Brien is his name. But
and
yeah.
Paige, people can work with you even. Can you share what you're
Mhm.
doing and how they can find you?
Sure. So I've had a cancer coaching consulting practice for almost 5 years. I launched it in February 2021. It's called Functional Cancer Care. It's all telehealth. Um, and I don't accept insurance because I just do coaching, consulting, and I work
Mhm.
with people all over the country. And you can follow me at Functional Cancer Care, or you can email me at paige@functionalcancercare.com.
Yeah, and
Love to work with you.
internationally, people have worked with you even.
Yeah.
I mean, yeah,
Yes, I've had some people from
phenomenal.
Canada
And
and
I
Jess
also,
has sent me a lot of people.
It's
and
so worth it. It's so we
Oh,
got her for free, and how lucky were we? Because as
I
much as
know.
chemo sucked, boy, did we had a real reduction in everything that could have
yeah,
gone wrong. Yeah.
she's great. I do also
So
want to mention Paige doesn't take insurance because insurance won't pay for it. So I don't want anyone like
Yeah, they won't.
we need to hate on the insurance companies aggressively.
Always.
Yeah.
And
Always and
and
forever.
Yes.
I do this because I've worked in conventional medicine and you don't have enough time to spend with patients and tell them all this stuff. And
Exactly.
there's so many things that I love, like, deep diving into like labs and making you feel better and working with supplements and food and whatever.
I
And you
love
don't have
that.
time to do that in a
No.
normal visit. So yeah, I'm happy to see anybody.
Great. And we'll definitely have you guys back. Thanks again.
Thank you so
Thank
much for
Thank you
you.
having us.
guys. Thank you for joining us today on My Breastie Says. Please don't forget to subscribe, like, and share this with a breastie who needs it. You can find us on Apple Podcasts, Spotify, or wherever you get your podcasts. Please don't forget to support our sponsors. We donate a portion of proceeds to charities supporting cancer patients in need. And we welcome questions and/or topic suggestions. So please submit at mybreastiesays.com.
The conversations on My Breastie Says are based on personal experiences and professional insight, but they are not intended to replace your medical advice. Always consult your doctor or licensed healthcare provider for medical guidance specific to your situation. We're here to support, not prescribe.
See you next time.
Bye!